Welcome, everyone. Thank you so much for joining us wherever you are across the world as we share the latest findings from the 2024 Air Quality Life Index update and unpack them with this air quality powerhouse panel that we have put together. My name is Christa Hasenkopf. I'm the director of the Clean Air Program at the Energy Policy Institute at the University of Chicago, or EPIC for short. The goal of EPIC's Clean Air Program is to bring actionable information about the quality of the air we breathe and its impacts on our health to every corner of the globe in order to motivate action and lay guideposts for efficient, effective air pollution policies. What we've seen in city after city and country after country is that having relevant information in the form of air quality data and its impacts is a necessary condition to be able to motivate that action. Research has shown that air pollution data in publicly available and relevant contexts through a variety of different civic and policy pathways can lead to substantially cleaner air over time. So our program works to bridge the major ground monitoring data gaps that exist across the world, especially in Africa, Asia, and Latin America. We've recently started the EPIC Air Quality Fund to help do just that. And the other core piece of our work is to put the impacts of air pollution, specifically PM 2.5, into one of the starkest and most important metrics possible, its impact on how long we live. That's where the Air Quality Life Index comes in and what we're here to talk about today. As practically all of us working in this field know, despite air pollution, and again, PM 2.5 pollution specifically, being identified earlier this year by the Global Burden of Disease effort as the largest threat to human health, more than HIV, AIDS, or malaria combined, the issue still falls far under the radar of public awareness and policy action. For example, HIV, AIDS, malaria, and tuberculosis, important issues, but ones that again have less of a collectively health-harming impact than PM 2.5 pollution. These issues have a $5 billion fund devoted towards solving them. There is no such fund for air pollution. The Clean Air Fund estimates that air pollution receives about 41.3 million philanthropic dollars devoted to the issue each year on average. That's 100 times less, and also less than the amount of spare change, for example, that Americans lose every year. And of that small global funding pie, most of that funding goes to the US, Europe, and Canada, which just feels 4% of that health burden from PM 2.5. The rest of the world, where 96% of that burden is felt, has been left hanging. So it's absolutely imperative that our community beats the drum as loudly as possible about air pollution as an issue that needs attention, and in the places that need that attention the most. And we, the air quality community, have been beating that drum loudly in 2024 so far in so many ways. Earlier this summer, the Health Effects Institute's State of Global Air came out with a report that air pollution is the second highest risk of death for children 5 and under. In a report also out this year in the Lancet Planetary Health, was revealed that more than 1 in 10 deaths in Delhi is attributable to air pollution. And last week, as many of you may have seen, the Air Quality Stripes for Cities project released by Jim McQuaid and Christy Pringle came out, and it was inspired by the popular climate stripes. And of course, today, we're beating the drum with you all with this presentation on the latest air quality life findings and the panel. So let's get to it. Tanushree Ganguly, the director of the Air Quality Life Index, will now present them. And after that, we'll go into our panel discussion. But if you have any questions during Tanushree's presentations, please use the Q&A feature to ask, and our team will be answering those questions as they come in. So with that, over to you, Tanushree.
Thank you so much, Christa, and welcome everybody. Thank you so much for making the time to join us for this very important discussion. As Christa said, we launched the report last week, but we thought today is a good day, and in the run-up for the International Day for Clean Air, for Blue Skies, it'll be a good time to sort of deep dive into some of the numbers that we have in the report and try and unpack why we are seeing what we are seeing. But before talking about why we are seeing what we are seeing, I think it'll be good for us to take a few seconds to just help everyone understand why the AQLI team does what it does. In other ways, it's what is it that motivates us to put out this information every year. So as some of you who've tuned in today might know, that the AQLI, the Air Quality Life Index, provides hyperlocal information on impact of air pollution on people's life expectancy. Our intent is for people to have access to such information so that they can strengthen their case for cleaner action. We believe that unless there is a demand, there is a ground-led demand for clean air, public policies will not be introduced to clean air. And therefore, we want this information to equip local movements, support communities in their demands for clean air action, thereby ensuring that billions of people across the world can live longer and healthier lives. Now, on to the results of this year's report. What is it that we are seeing? We're seeing that even today, globally, people are likely to lose almost 2 years of their life as a result of breathing air that does not meet the WHO guideline for particulate concentration. And if you look at the comparison of air pollution's risk against some of the other external threats like tobacco or child and maternal malnutrition or transport injuries or unsafe water usage, you'll see that PM 2.5 ranks first in that list. And like Christa was saying, some of these external threats are much better funded than particulate pollution is, particularly in those areas where the risk of particulate pollution is higher. But we just want to reinforce that the evidence is loud, clear, and stark, that air pollution, particulate pollution in particular, is the greatest external threat to human life expectancy. Now, this year we saw pollution levels declining. And that, of course, got us very curious to understand what are the kind of trends that we are seeing regionally. Here's what we saw. South Asia, which has traditionally, historically, at least for the last decade or so, been labeled as the hotspot of global air pollution, the epicenter of global air pollution. These are the kind of phrases that have been used to describe the extent of pollution that we see in South Asia. We saw an 18% decline in particulate concentrations in South Asia in 2022 relative to 2021. If we look at the comparison between the PM 2.5 levels in 2022 versus the last decade, we are still seeing about a 16% decline. On the other hand, the Middle East and North African region, we are seeing a 13% increase in PM 2.5. Now, what does this mean for life expectancy? The good news from South Asia, if the decline is sustained, then South Asians could live almost a year longer. The bad news in MENA, if the increase continues, then people are likely to lose more than 3 months of their life as a result of exposure to polluted air. Now, air pollution is not just a public health concern anymore. It is as much a concern of inequality, as this chart shows. So on the left side, you'll see how pollution levels vary in the cleanest parts of the world and the most polluted parts of the world. So our analysis tells us that people who live in the most polluted parts of the world are exposed to air which is 6 times more polluted than people who live in the cleanest parts of the world. As a result of this, they are likely to lose almost 2.7 years of their life more than those living in the cleaner parts. So when we talk about air pollution as a public health concern, we are also missing out the effect that it's manifesting itself as far as making the society unequal is. All right. As you know, every year, or as some of you might know, every year the Air Quality Life Index report focuses on a theme. The last time we focused on, again, the inequality in access to resources for combating air pollution. And then we spoke about resources in terms of access to funding or access to air quality data. This time we continue sort of speaking to the topic of inequality, but we're looking at ambitions that countries have. So what we find is that countries not only have unequal burdens stemming from air pollution, but the ambitions that countries have towards combating air pollution, that also varies significantly. So as you see on this plot, and I'm not sure, how clear it is given the resolution of the plot, but out of the 252 countries and territories that we analyzed in this report, only 94 countries actually have an annual ambient PM 2.5 standard. What this means is that 50% of the countries don't have a standard in place to regulate PM 2.5. And within the 94 countries which have PM 2.5 standards, these standards vary from 5 microgram per meter cube, which is consistent with the WHO guideline, to 50 microgram per meter cube. So you can see that the scale is very, very wide as far as air pollution is concerned, or the standards for regulating air pollution is concerned. The next piece I mean, although countries have standards, it does not necessarily mean that they're able to meet them. Our analysis tells us that 30% of the world's population today lives in regions that don't meet even their national standard. So everywhere where you see a blue, the countries meet their standard there, and everywhere you see a dark gray, that's where the countries don't meet their standard. It does appear that a significant portion of the world right now lives in regions which meet their standard. That's also because we saw a remarkable decline in pollution levels, particularly in South Asia and most parts of Asia, which could be temporary or which could sustain. It's difficult to say unless we look at the data for the next year. My final slide. All of us say that air pollution, 99% of the world today breathes air which is not compliant with the WHO guideline. But it's also very important for us to understand that countries are still struggling to meet their own national standards, which is potentially 2 times, 3 times the WHO guideline. And as you can see, that if countries were to meet even their own standards, life expectancy could go up significantly. Our estimates tell us that even if countries meet their own standards, life expectancy could go up by 1.2 years. And everywhere where you see the orange and the red, those are the regions where the improvements in life expectancy could be the highest. I just wanted to make a quick note. I mean, in the past AQLI reports, we've not included the standard for Brazil. Brazil's standard for PM 2.5 is 10 microgram per meter cube. And as you can see, there are significant part of Brazil does not meet that standard. Yes, of course, the Indo-Gangetic Plain is a place where we know that countries don't meet their targets, but it was also, at least for us, while we were looking at the data, to see that there are parts, even in South America, where meeting the country's standards is becoming a challenge. With that, it's a wrap on my presentation. I will just quickly summarize our key findings or my 4 key takeaways, because I feel that, this will guide the discussion as we proceed. Our first key standard is that countries have standards, but they are failing to meet them. Our second key takeaway is that the burden of air pollution is unequal across the world. And third key takeaway is that air pollution is both a concern of inequality and public health, and it is, till date, the greatest threat to human life expectancy. I'll stop right there. Back to you, Christa.
Thank you, Tanushree, for highlighting the key points from the update. And we are now perfectly teed up for our panel discussion to dive into these findings. And something in particular we'll dive into is the dip in air pollution in South Asia and the increase in the Middle East and North Africa regions. While the AQLI update tracks trends and changes in air quality and its impact on life expectancy across the world, it's not really within the report's mandate to decipher the causes of why these trends are occurring. Why is air pollution improving in one place? Why is it worsening in another? That's why we are so excited to pull in this expert group of panelists representing different fields of work that revolve around air pollution, so we can collectively better understand the context and meaning behind these trends, and so we can figure out where to go from here. So with that, let's introduce the panel, and I'll ask folks as they're able to turn on their video. First moderating, I'm pleased to introduce Mr. Chetan Bhattacharji. Chetan is a journalist, editorial lead, and climate communications consultant. He's the former senior managing director at NDTV 24/7. He writes about the impacts of climate and pollution on health and business, and we are proud to count him as an epic air quality champion as well. I'm also pleased to introduce Dr. Aaron Van Donkelaar, who is one of the world's experts at producing satellite-derived PM 2.5 data sets, including the one that the AQLI relies on, as well as many other air quality efforts across the world. He's a research associate at the Atmospheric Composition Analysis Group based at Washington University in St. Louis. And one of the beautiful aspects of his work is that it can be used to provide insights into exposure-related health effects in regions where there's little ground monitoring data, which, as we've mentioned, includes some of the most heavily polluted and populated places on the planet. We're grateful to our partnership with his team and look forward to his insights on global trends this year. It's also a great pleasure to have Ms. Heba Safi with us today as well. She is with us from the World Health Organization's regional office for the Eastern Mediterranean, With her toxicology background and wide experience supporting the 22 countries of the Eastern Mediterranean region on environmental health risks, she's helped build health sectors' capacities to better understand and quantify the health burden of air pollution and its economic impacts as well. We are especially grateful to her today to help us unpack the trends across the Middle East and North Africa region, where we've seen an uptick in pollution this year. And last, but certainly not least, we'll have the perspective of another world expert on air pollution, someone who analyzes where air pollution actually comes from, the why, Dr. Sarath Guttikunda, founder and director of Urban Emissions. He's been conducting research in an independent capacity to support science, policy, and public dialogue on air pollution in India and across the world for the better part of 2 decades. And we're also proud to call him an epic air quality champion as well. We are looking forward to Sarath helping us understand what's behind the significant drop in PM 2.5 that's been observed across South Asia this year. So with that, please take it away, Chetan.
Christa, Tanushree, thanks very much for that intro and for setting up this discussion. We have about 30 minutes to pick the minds of our experts to understand the latest in air quality trends and, of course, the AQLI. So, if I may sort of begin by saying that this is going to be at 3 levels, globally with Dr. Aaron Van Donkelaar, in the Middle East and North Africa with Ms. Heba, Safi, and finally what's happening here in South Asia, where we are, most of us are, at least some of us, is Sarath. So if I may also just mention before we start that the challenge that we often see is that there's a lot of great data and research on air pollution, and it comes out periodically. But if you can just keep this in mind over the next half an hour or so, how do we convert this into persuasive calls to action and policy interventions? I think if I can request all our experts to somehow weave this in, what their perspective could be, that would be useful. So, Sarath, if I may begin with you, the latest data from AQLI finds that 2022 air pollution dipped across the world and something like 18%. How would you explain the decline in South Asia's pollution levels? And should one read 1 year versus a long-term trend? I mean, is that something that is advisable? Because we do know that, as soon as the rain and wind stop, pollution shoots up. I think you're on mute, Sarath.
Will Tanushree share those 2 slides, or we just go talking? So I have these 2 slides here, more to make a case for action across the sectors. The reason why I say that is because the dip that we're seeing now is, I think it's very, very temporary. I mean, we do see the dip in the modeling results. We see the dip in the AQLI calculations as well. And these are coming from the global models. Aaron can explain a little bit more about where those come from. And when we look at the satellite feeds, we see the changes saying across India, for example, there is a change in the AOD. So these are all columnar numbers. But I think when I start digging a little bit more, if you look at another satellite feed, Tropomi, they don't give you the absolute AOD, they give you the residual aerosol index, which means that if it moves more positive, the loading of dust and smoke is more than your non-absorbing aerosols like sulfates and nitrates. So between 2019 and 2023, what we're seeing is actually moving towards more positive, means that the dust loading and the smoke is more. But if you feel from all the stories that we're seeing from the city is generally PM10 and PM2.5 going down, there's a lot of dust management activities that are happening in the city. If the dust is going down, which means that your smoke numbers, the carbonaceous aerosols, BC and OC are actually going up. BC and OC are combustion sources, which means that a lot of combustion activity is still continuing. So I think this is where we need to start focusing on not only on just one pollutant, which is actually seeing a big change because of one major activity that's happening in the cities, but start looking at a holistic way. Just to strengthen that story, when we look at the same NO2 and SO2, again, they are primarily from combustion activities and they're growing up. Now they're, on average, they're still growing up at a significant numbers, very similar to what we're seeing in AOD as well. Can you see the next slide, please? I think if you look at the actual fuel combustion that's happening on the ground, everything is still increasing. We're not seeing a big drop, a big change, a dramatic change in those trends. So that tells me that while we are seeing a drop in PM10 and PM2.5, mainly coming from the dust management activities in the cities, which is reflected both in the ground monitoring data and also the satellite data. On the combustion side, on the fossil fuel combustion side, the story is still continuing. I think this is something that we should definitely keep in mind going forward. So coming back to the point that Chetan said, right now the dip that we are seeing is, I think, is a temporary one, and we should be cautious moving forward given the trends in the fuel combustion.
Thanks for that. Aaron, if I may just stay on the same issue about the decline in global pollution levels. How would you explain the change in global pollution trends in 2022, in particular the contrasting trends that we see in different parts of the world?
Yeah, so I'm not sure if you want me to walk through different parts of the world. If you bring up my slides from it, I can probably just walk through them a little bit easier. But I mean, there are lots of reasons that you can have different trends. What might help a little bit would be to understand how the PM2.5 data is produced. I just want to spend a moment talking about that. So when we produce these PM2.5 data set, we're really relying on three main different data sources. The primary data source is from satellites, from aerosol optical depth retrievals. And most of you are probably familiar with aerosol optical depth, but for those of you who aren't, this is essentially an optical measure of the aerosol throughout the entire atmospheric column. So it goes right down to the surface, all the way up to the top of the atmosphere. And we combine that with the chemical transport model. And again, if you're not familiar with those are essentially very complex computer models that combine the physics and chemistry of the atmosphere with emissions, up-to-date emissions, and meteorology. And using the output from that model, we're not only able to get an additional source of aerosol optical depth, but a way to relate AOD to PM2.5 in a physically meaningful way. We then further refine those based upon comparison of those more purely satellite-based estimates with ground-based monitors. And we do that in a statistical framework. So by taking all the unique strengths of these different data sets, we're then able to have a very strong data set with which to represent PM2.5. And many of you have seen maps like you see down below. This is just the 2022 annual mean PM2.5 around the world. So log scale, of course, very large variations. If you go to the next slide, I can start to answer your question a little more directly. So here I've plotted on the left-hand side, this is the difference between the annual mean 2022 PM2.5 estimates and the 5 years preceding that. And one of the strengths of our approach to estimating PM2.5 is that it provides a consistent method to estimate PM2.5 both spatially as well as back in time. So if you look on the right-hand panel, you can see regional mean, population-weighted regional mean PM2.5 concentrations for several selected regions. Over China, South Asia, we talked about a bit, MENA, Western Europe, North America. And so as we look around the world, drawing back to the left-hand panel, again, drawing back to your original question, we see lots of individual features, different stories about increases and decreases, and each region will have its own story. So, of course, China being obviously a major feature, you can see large decreases compared to 5-year averages. If you draw back to the left-hand panel, you can see this has been part of a very long, steady decline. And this is really driven by government policy. The Chinese government decided about a decade ago to really start tackling air pollution, and they have done a remarkable job of doing that. Compare that to over South Asia, already been discussed a little bit, where we see this very strange blip in 2022. Still a subject of some discussion what's driving that, whether that's meteorologically driven or not. As Sarath said, I really will remain curious as we start to work towards producing 2023 estimates, if this is a long-term shift or more of a temporary blip. And it's entirely likely it could be a temporary blip driven by some weather anomaly or something. It's not something we've delved into really deeply. As you look around the world in other spots, of course, you see further north of Siberia, parts of North America, lots of little blotches of highs and lows. And these tend to be more from wildfire events. And so over places like Siberia or North America, you can have major events that happen. They happen once a year. A major fire only happens once over that period. It's not necessarily indicative of a trend, but that region has a anomalous conditions. And so that's what you tend to see in those regions. Although over North America, I would stress that there are definitely is evidence that there's increasing wildfire activity. And to that point, if you look on the left-hand panel and at the right-hand panel, and you see North American long-term trends, you can see North American PM25 has declined fairly steadily for much of the time period, but more recently, around 2015 or so, we see that leveling out. And that really has to do with increased biomass burning. So wildfires in the West, Western Canada, Western US getting more and more fires, which are counteracting gains that have come prior to that. You can also see over the Amazon, over the Congo, some changes slightly higher in Amazon than the previous 5-year mean, and Congo slightly lower. It's worth bearing in mind how high those concentrations are. So when we're talking a change of between 2 and 5 micrograms per cubic meter in those regions, it's about a 5 to 10% change. It's certainly a big difference, but it's kind of within the variability we see. Those are really biomass burning driven. That's more controlled fires due to different practices that go on there. But those are regular fires that occur each year. One of the more interesting features I saw was actually over Ukraine, which you see this little slight decrease over there. As many of you would be quite aware, obviously some conflict in that region started at the start of 2022. That has a way of certainly impacting industry and standard practices. And my guess is that what we're seeing is a decrease really to the impact on industries in the Ukrainian sort of region. Yeah, hopefully that gives you a rough feel of different regions around the world. I guess one other point, of course, is Western Europe. You saw a steady decline there, and that really has to do with different government initiatives.
Thanks, Aaron. We'll just return to this issue. And if I may come to you, Heba, is there enough? This is one region where we saw a substantial increase in air pollution in 2022, I think it was about 13%, right? Is there enough evidence available to explain what's increasing the pollution levels in the MENA region?
Okay. Thanks, Chetan, for the question, and thanks for the colleagues attending. Before addressing or answering the question, please allow me just to notify that I would like to talk about the Eastern Mediterranean or WHO Eastern Mediterranean region, which consists of around 22 countries distributed in Northern African part, Middle East, Iran, Afghanistan, and Pakistan. Next slide. The latest WHO estimates in 2021 showed that the WHO Eastern Mediterranean region has the highest population-weighted exposure of PM10 as well as NO2, exceeding the WHO air quality guidelines, which released in 2021 by 12 and 5 times respectively, which is a very, let me say, high concentrations. Next slide, please. Okay, this slide elaborates the population-weighted exposure for PM2.5 over the years since 2010 to 2019, which elaborates that the Eastern Mediterranean countries didn't experience any improvement in air quality, but worsening air pollution in several or major parts of the city. And that's mainly, which answers your question, Chetan, directly, and that's because that the region's air quality is extremely affected by natural sources, particularly sand and dust storm events, which contribute around 30 to 60% of the total particulate matter levels across several Eastern Mediterranean countries. However, anthropogenic sources such as unsustainable development, continuing urbanization, industrialization, transportation, and open burning of municipal and agricultural waste, as well as other specific sources like diesel generations, are widely spread and considerable and should be tackled and managed. However, it's also worth to mention that our region, unfortunately, is the second highest affected region by climate change after WHO Afro region. And there's a growing body of evidence shows that climate change is intended to increase the intensity, frequency, and the duration of sand and dust storm events in the region. For instance, it's projected in Iraq to experience 300 dusty days per year in the coming century, which is, let me say, should be an alert for the policymakers to tackle whether the natural and anthropogenic sources to reduce the sources of air pollution in order to minimize the health burden. Thank you.
Thanks. Speaking about the natural causes of air pollution and its dust storms in that part of the world, Sarath, coming to you, how would you distinguish between the impact of weather and policy action on South Asia's pollution levels? Because there have been recent reports and recent evidence from India suggests that the decline in India's PM 2.5 levels in recent years have been can be significantly attributed to favorable weather conditions.
Thanks, Chetan. I think a couple other members have also, audience have also raised the same question. I think that the studies are, they have a case to make. There is a significant change in the weather conditions, but we also have to keep in mind that the inventories used are not from the current years, they are from different years. I think it's an older year study. So that will definitely have an impact. But definitely we cannot ignore the fact that the wind conditions, the meteorological conditions in 2022 and 2023 were definitely better. More rain was there. Generally, the western disturbances were also a lot more sustained, especially on the west coast and along the Indo-Gangetic plain. They did play a significant role. But at the same time, when it comes to these drops, because some of these model runs are also using the ground measurements, and then the ground measurements are coming actually from the cities where there is some action. We cannot neglect that. So the actions are coming from the dust management for road dust. And then you do have a big bump in the EV uptake, especially in the cities. And because most of the monitoring data that we are seeing is only coming from the cities. That is there. And we also have a significant increase in the natural gas usage. That's the last figure in my second slide. All that definitely had a little push. But now the important thing to see is we're going to exhaust dust management work, and then the other emissions will start going to go up. Are we going to sustain this blip or not? So MET plays a role, definitely MET plays a role, but there is some action also happening on the ground, but not as much as what we're seeing in terms of explanations.
So that action on the ground that you're referring to is insufficient to counter or to subsume the other action of what you pointed out, increased combustion, increased burning.
Exactly. Yeah.
I see. Aaron, if I may just come to you on how the PM 2.5 estimates accounting for emissions of precursor pollutants like NOx and SOx, especially given that recent evidence suggests that these might be going up in some of the countries where we are seeing a decline, a dip in PM 2.5 concentrations.
Sure. So this is why I wanted to spend a little time talking about how we produce the estimates. So there's a lot of different data sources that go into producing these estimates, and it's not just the emission inventory. So the satellite retrievals of aerosol optical depth, if there is a change in emissions from a particular source and that's impacting PM2.5, those satellite observations will detect that increase or decrease depending which region we're talking about, and that will be reflected there. Additionally, ground-based monitors, of course, are also constraining that at the end. So locations that are nearby to or have general trends we can infer things from about the PM2.5 monitors themselves. That helps us to capture any changes, such as you mentioned with SOx and NOx. Also, specifically in the case of SOx and NOx, in many parts of the world, those sources aren't really the dominant contributors to PM2.5. And so if you have, NOx emissions increasing, really a lot of your PM2.5 concentration in many cases is associated with organic matter instead. And so you can have one source going up and another source going down, and that really can be driving your overall trends, even if one particular source or sector is changing in the opposite direction of the overall trend.
That's interesting because personally, I'd really like to know how would a government or how would an authority, which is say in charge of either an airshed ideally, otherwise even a city or an entire province, if not an entire country, how would they be tackling this or monitoring this on a day-to-day basis or a week to week or on a very frequent basis to be able to, step up policy interventions, keep it dynamic perhaps? And to both Sarath and you, Aaron.
Yeah, Sarath, do you want to go first? I guess I'll go first.
Yeah, go.
So there are lots of different ways to approach that. It unfortunately becomes more complicated, is the short answer, right? So setting up a PM25 monitor is really helpful and hugely insightful. Sometimes tracking down why you have that PM25 concentration can be more complicated, and that can involve lots of different places you can get insights. So one way to get more insight is to have compositional information. So you can break it down. There's some networks, such as Spartan, for example, that measure composition as well. And so you can say, oh, if our PM25 is largely organic matter, or if it's largely nitrate, that gives you some insight into where it's coming from. You can also use tools like chemical transfer models. And so one of the major advantages of a model, as I mentioned a little bit, we use, is that you can run test simulations where you have your emission inventory, the best one you have available, and you can do test scenarios to say, well, what happens if we reduced agricultural emissions by 50%? How does that impact PM25? And so that's another tool you use. In my experience, there isn't one magic tool that solves everything, but it tends to be looking at multiple data sources from different angles and getting a consensus understanding about it. And that's really how I would go about that. I'm not sure, Sarath, if you have more to add.
Hi. Traditionally speaking, the way we track progress or there's no progress or lack of progress is through ambient air quality monitoring. So, which means that the main reason for that is we believe in what can be physically measured, especially from a regulatory perspective. If we can see the box and we see the number coming from the box, we believe in that. So generally speaking, if we can increase that monitoring capacity, and I'm not talking about that just in India, but across the world, then we have a better way of tracking what's happening with the ambient air quality. So, but in the absence of that, which is the case, these emission inventories and chemical transfer models really help. But that to be as reliable as we want them to be, the inventories have to be strong, which means that the baselines that we are trying to create for sectors, not just anthropogenic combustion sectors, but also for natural emissions, especially in the Middle East, it becomes a huge issue. Trying to understand their even the generation of those emissions, propagation of those emissions, and then deposition of those emissions, that really makes a huge difference. For that, I think understanding the emissions baselines across the world with good confidence, that will really help us track what's happening on whether it's week to week or even month to month. Yeah.
And then just to jump that a little bit, but then also tying that into the local conditions that can be driving it. I mean, local meteorological, the Indo-Gangetic Plains I mentioned, where it's really tough location because you've got this valley which traps the pollution in there so tightly. So, the exact same action which might lead to great gains over China might not actually be the same action you need to produce over something like the Indo-Gangetic Plain. You have to understand the local conditions to some extent as well.
And at this point, I'd just like to shout out to AQLI's new fund, which is actually encouraging more low-cost monitors in vast parts of the world which are not covered by monitors. Coming to the MENA region, if I may ask you, Heba, what kind of evidence would be needed to further understand the pollution scenario in the Middle East and North Africa?
Yes, absolutely. As mentioned by my colleagues earlier, source apportionment and emission inventories at the national levels for key air pollutants is essential to better understand the situation of air pollution, the major sources at the national level. In addition, it's worth to start studying the interlinkages between climatic hazards or climate change and air pollution, how climate change can affect the air quality levels over the years. In addition, there is a growing body of evidence shows that there is an interlinkages between heat waves as well as air pollution. So we need to study or to better studying this area to better understand the future scenarios that we say of air quality levels across the globe. Another area that directly affect as well air quality and Eastern Mediterranean region as the recurrent and ongoing natural and political emergencies and conflicts. So there is a need as well to study the impact of emergences on air quality levels. And one of the most important field is to start investigating or studying or conducting epidemiological studies to better understand the impact of dust exposure, which is to understand, is the dust holds the same impact of particulate matter, or it is more toxic or less toxic when it comes for the dust particles. So these areas are, let me say, burning areas for our region that need to be more investigated in. Over.
Thanks very much. I can see that we are almost at the end of the time allotted for the discussion. I can see the questions piling up. So I'd like to just summarize. Any last comments, Heba, if I may begin with you? Any last comments on this issue, and then we'll go to Aaron and Sarath.
Yes, from my side, it's fine.
Aaron.
No, I think we've covered done a pretty good job
Okay,
covering.
great. Okay, Sarath.
I think use of indicators like these, AQLI, air quality index, health impacts, and even generally putting out absolute air quality numbers, PM 2.5 numbers from these global models, is a really effective way of raising awareness. And we hope that this can be really helpful in getting more people to talk about it, and then more people to do something in raising those baseline information that we can definitely use in telling a better story.
Thanks. So just to summarize very quickly, and then I'll hand over to Christa, that the dips that we've seen are probably blips. So we need to focus on combustion, which there is enough indication that seems to be increasing. Local factors matter a lot. So I think the solutions in one region or in one place are unlikely to be applicable in another. I think the Middle East, North Africa's main problem of which has seen pollution rising is to understand the health the health impacts of exposure to dust particles, which I think is seems to be emerging as quite a severe problem. And of course, increasing monitoring, that is absolutely critical, increasing it to as many parts of the world as possible. And I think that's an effort that I think EPIC has already begun with its initiative. I'd like to hand back to Christa, but with a question that, on this AQLI, ideally, what is the kind of acceptance of the use of AQLI that you would like to see? Because it's been now, I think it's been coming out for some years. So where would you like to see, or how would you like to see it being implemented?
Thank you, Chetan, for also moderating a thought-provoking session. It's great to see the AQLI referenced in the media or by the public and by decision makers from time to time. But I'd say even more than that, what we'd like the AQLI to be used for is as a tool for setting aspirational policy. A lot of air pollution statistics are very gloomy. That's the nature of this issue. But the beauty of the AQLI is that the stat can be turned on its head. How long could the average person live if we reduce levels by 10%, 20%, or to our national standard? Or if we were to really get a handle on reducing this one particular source of air pollution in a given location, how much could that have an impact on our lives? So our hope is it can be used as a way to show what is possible in both the big picture, and then also when breaking it down to these concrete pieces that designate next steps and ultimately motivate more action. So thanks for that question. So now we'd like to hear from you, the audience. We've gotten a bunch of questions. I think folks have figured out the Q&A features, so I don't know if I need to call it out again. And I'll just dive in. So a question we received from Newton Matandarotia has been, what are some of the factors that are making countries fail to meet their own ambient air quality standards? We saw in Tanushree's presentation that the majority of countries and territories currently aren't meeting their standards or haven't set one. And so I'll open that up to anyone on the panel that might be interested, including Chetan, by the way. If anyone has thoughts on why countries are not meeting their own standards and what factors play into that.
Sure. I mean, I'll take a quick initial stab at it. I mean, there Honestly, there are lots of factors. They can be economic factors that it's expensive to change. They can be sometimes difficult to determine exactly why your concentrations are what they are. Sometimes there's even just a lack of motivation or awareness of the actual cost. This is where, again, AQLI can be really important, is actually put a direct cost, say, well, no, by not doing this, here's what's happening. And the increase that awareness, I think, is another factor which can drive it.
Over to you, Heba. I saw your hand up.
Yes, thank you. Adding to Aaron answer, just some of the countries setting the national ambient air quality standards just to be a national standards, but it's not incorporated in the overall air quality management plan at the regional level. So technically, they are not using the national ambient air quality standard as a target to be reached, but as a numerical value that exists to show that we do have a standards and we are facing this a lot in our region. So having a national ambient air quality should be based on health, that our main ultimate goal is to protect the public health in line with WHO air quality guidelines, which is based on health as well, and is a part of the overall air quality management plan. So any single interventions within the health sector or within the other sectors aims to reduce air pollution and improve air quality should be incorporated in an overall air quality management plan at the national and subnational level. That's right. Thank you. Over.
Thanks. Any other thoughts?
I think my usual line, the baseline information really needs to be kicked in. So because a lot of countries lack that baseline understanding of how bad the emission levels are. And if we don't understand that baseline, we blindly just pick one number saying that, okay, I'll take this WHO's number and make it a standard. Then that literally backfires. So if we really understand local emission sources, local baseline numbers, then country can basically set their own national standard. So they don't have, and upper tier is aspiring to WHO's guideline, but no, you start in tiers and then you come up basically.
Thanks for that. And a related question came in. I'm not sure who to attribute it to, but some countries, especially I would say in the MENA region, experience high fraction of natural PM 2.5. And so how do you take consideration into the natural fraction of PM 2.5, especially where it's high? How do you take that into consideration for a PM 2.5 standard? It might be especially challenging, obviously, to get to certain levels with the natural fraction being so high. But I don't know if anyone, especially Heba, if you might have thoughts on that.
Yes, absolutely. It's quite challenging, let me say, to consider the portion of dust and the overall air pollution in several parts of the region. The particulate matter to the 5 could reach 5,000 microgram per cubic meter due to a sand and dust storm, which is a very high. Many of the countries include this as an outlier, which is not an ideal, of course, but when it comes for health, we do recommend having health messages to the public to reduce the exposure for the event or the storm. In order we cannot control, let me say, at the national level, but we can reduce the exposure at the population side. I don't know if the colleagues would like to add.
Generally speaking, it's, for example, if there's a big dust storm, the alert system is significantly stronger than any of the other regions, almost all the Middle Eastern countries. So you do have the system in place. So as far as that is concerned, I think that has a big contribution to PM10. At least when the storms are happening, everybody is shielded. But the major problem comes in when that wind initiated storms are not happening. When everything is generated because of vehicle use, because all the dust is trapped on the road and you have a lot of dust resuspension that's happening because of vehicles moving at really fast speeds and all the combustion activities that are happening. So that is more harmful than the big dust storm that passes by over 1 or 2 hours.
And for my part, man, I'd say I kind of have, almost two minds to the question. I kind of took more about to do with what do you about standards when you have these natural sources? And I honestly really have two minds for it because in one sense, I mean, it's nobody's fault if there's a big dust storm going through town, and so the government can't really be expected to stop that. But it does, my understanding based on literature, PM2.5 is still best represented in terms of health impact in terms of all composition. And that's where I think perhaps more studies need to be done to see if there is a case to make that dust or, sea salt, also called in this camp, has less impact. I mean, I want to believe, natural isn't going to cause the same damage. I haven't seen that borne out in the literature quite as much. And I think what it needs really is a little more research to say, can we make a case for a different standard to say, you need to worry more about, say, black carbon emissions comes up a little bit in this field with some evidence that perhaps that is a bit more damaging. And so I think there is a case to make a different standard, but my understanding of literature right now is that PM2.5 is PM2.5 is PM2.5 from a health perspective.
Thanks for all those responses. So staying in the MENA region, and I think this has this question has implications for other data constraints in the satellite-derived estimates, which we've already talked on in the previous moderated session. But Bhushan Tuladar from FHI 360 in Kathmandu, Nepal asks, countries like Qatar and Kuwait have a large migrant population. Does the population weighted average PM2.5 take into consideration this population as well? Again, I think there's some broader question around here of just the data constraints that we're living with when using this data that I believe Aaron might have lightly touched on already, but anyone have comments about that in particular? About how, maybe populations that aren't necessarily accounted for could affect the data? Or more broadly, again, the data constraints on satellite-derived estimates. Probably best a question for Heba or Aaron, or anyone else wants to chime in.
So, I mean, I can speak to, from a limitation. So, I mean, AQLI, and perhaps this comes back to you, Christa, a little bit, depending what population-weighted data set you're using. Estimating population is actually fairly complicated too. And when we make estimates, we use the CDAC-based data set, and it's a pretty good data set, but there are lots of different ways to try and measure that. And certainly a population which is not included in those data sets would be missed from a population-weighted average. For the satellite-derived estimates themselves of PM2.5, it's actually done on a gridded scale, ends up being about between about 1 by 1 kilometer degree resolution. And so as long as you know where the people are, that's just fine. But the challenge really becomes, do you know where the people are?
May I add as well? Okay. Yes, this is quite challenging when it comes for many of our countries because we do have several migrants and several forms. I agree that population-weighted exposure counts the total population, including the migrants, when it comes for GCC countries, Qatar and Kuwait, etc. However, the most challenging part is when considered the health output. When the mortality registered, usually it's registered with outside the migration country, outside Qatar and Kuwait. This will reduce the health burden of air pollution exposure or the health burden of exposure to air pollution levels, for instance, in Kuwait and Qatar. This creates a quite challenging, issue in estimating not only the population-weighted exposure, but also the total burden of air pollution at the national level. That's why we are encouraging the countries to conduct their own national or epidemiological studies at the Kuwaiti or Qatari population, at the residents of the country. Noting that air pollution is a long-term issue, so the migrant should expose for at least 10 to 15 years in order to be mainly affected by air pollution.
Thanks
at the long term.
Thanks for that. And we'll move. Oh, Aaron, did you have one more?
Yeah, I had one more additional thought on this, which is something perhaps to consider in future with AQLI a little bit, is that the satellite doesn't have to just be an annual mean value. We actually do have finer temporal resolution, and if data did become available that we know a migrant population is here 1 month and somewhere else in a different season, it is actually something that could conceivably be accounted for if, again, we knew where those populations were at different times of year, which would perhaps be a really good development for certain regions.
That's a great point. That's a really great point. Interesting one too. So moving on to another question from Sunkuru Torre at the Permian Lung Institute, Health Institute from the Gambia and the United States. He asks, one significant challenge for African countries particularly is the limited capacity within national environment agencies due to a shortage of professionals equipped with knowledge in atmospheric science and air pollution monitoring. To implement effective changes, it's crucial to empower local actors who can utilize data like the AQLI, of course, other types too. How can we address this gap? So, small question, I know. Does anyone have thoughts on addressing?
I mean, it's a universal problem, and I mean, this is something that we also discussed between you, Tanushree, and you and Tanushree. I mean, there's some of the training courses. I mean, when we understand the models, we put these models together, and then we run the data, and then and we put this data out saying how use it. But I mean, we also need to have some kind of operational training for people to how to use this data, or even as fundamental as you got this monitoring network of 10 stations. So what do I do with this data, or how this data gets used for health impact analysis? How does it get used for this chemical transport modeling? I mean, we're not expecting them to start integrating and doing all the modeling work, but at least understanding how those numbers flow from the generation to the final usage, like this AQLI. I think an operational training program will definitely be helpful across the regions, not just in Africa.
Thanks for that. Aaron, do you have a thought?
Yeah, I mean, just briefly, I mean, I think this is a really great question about engagement is really important. And AQLI, of course, is focused on that, but also at the ground level to get people engaged to even, low cost sensors get a lot of talk and there's certainly a lot of value in them. But to have those resources that tie people together is really important too, that you can have someone who does work with the data in a more detailed sense, can help guide and hopefully excite the local actors as well. That becomes a two-way street, not just us taking in data from some black box and working with it, but also people who understand the local conditions, who provide insight into, honestly, if something looks amiss, it's actually the best questions I get are, this doesn't quite look right. And I get to dive into it. And, that small question for some remote part of Africa, which I have never been to, and I'd love to, but I can't get everywhere. The local insight is tremendously valuable for us improving these estimates. And I think that's where there's a lot of room for that two-way street. And hopefully that local excitement and engagement to say, no, that local knowledge is really important to improving not just that one spot, but that insight we gain there can have, global impacts, which is really great.
Thanks for that. And I think we'll wrap up with a last question I have for each of you. And it's, what gives each of you the most hope about us being able to tackle air pollution, whether it's at the global level or in the particular region of the world that you most operate in? I'd love to hear what gives you hope.
And for me, data gives me hope. When more data is always helpful, and if we can actually engage people to generate that data that's useful, I think it really makes a lot of case for telling more stories. Like Aaron said, we can customize those stories to local people, and they can take action from it.
Yeah, I mean, I think I would say that what gives me hope is, well, that it can be done. I mean, China for me is this prime example where you see a government that really decided to do something about it, and it can be done. And China is not alone in having such high levels. India, MENA, all these, I mean, it can be done. It just requires the will to do it. And I take hope in, honestly, initiatives like AQLI that are saying, well, how can we take this data, which can be extremely complicated in the details, but can also be made in a much more accessible way. And initiatives like that give me hope because it's going to help people understand and hopefully be motivated to say, look, here's the lives lost. It's a very accessible metric, which is really wonderful to see.
Yes, for me, when I'm the most thing that gives me hope when I see or meet one of the high-level leadership, the ministries, they are really believe that air pollution is a major public health concern, and they not form, let me say, a resistance in establishing or conducting any intervention towards reducing air quality, reducing air pollution levels. So this is the most important thing that I hope as well to draw the attention of the policymakers in this area, because seriously, it's quite challenging to achieve a significant improvement in air quality without support from them. Thank you.
Thank you. And on that hopeful note, we'll need to wrap up the Q&A session. I want to thank everyone for attending, and most especially our Air Quality All-Star panelists for joining us and sharing their insights. And to follow up on one more hopeful note, climate change and air pollution really are two sides of the same carbon-fueled coin. But with climate change, atmospheric physics commits us to a hotter world for our lifetimes, even if we turn off all greenhouse gases right now. And it's become popular to say this is the hottest summer we've ever experienced and the coolest one for the rest of our lives, which is a bummer. That's not the hopeful. But that's not so with air pollution. That's the great part. If we decided to quit emitting air pollution, levels would drop in a matter of days and weeks. And of course, that's not realistic, but what is realistic is that these can be the most polluted days of the rest of our lives, and the air can only get cleaner from here on out if we decide to make it so. And in my opinion, one day and at one point we will. It's just a matter of when. So I want to thank you again for joining, and thank you for all the work everyone who's joining from across the world is doing to make cleaner air a reality everywhere. Goodbye, everybody.